along the conversation, but you have to watch there.
You have looked into my eyes. You have seen what I am, but still you're by my side, telling me I can't. And there are times I've caused you pain, and times I've made mistakes. Somehow you use them all to make the eye you made. Oh, every good thing I have done, everything that I've become, everything.
Welcome to All About Us Teen Talk TV. We'd like to thank you for joining us today. Please go to our, order your magazine, All About Us Youth Magazine. You can go to www.aaUYM.com. Again, the website is www.aaUYM.com. You can also reach us about today's topics or questions at aau.tv.radio@gmail.com. Again, that is aau.tv.radio@gmail.com. And today we will have Ms. Shea, who will be introducing our guests.
Today we have Dr. Marson. We will be discussing attitudinal differences in mental health between younger and older adults. Thank you, thank you, Dr. Marson, for coming today. Tell us a little bit about yourself.
Thank you for having me. My name is Dr. Marson, and I am by profession a licensed clinical social worker. Over the years, I have worked with many different populations, including the elderly, at-risk adolescents, domestic violence, sexual abuse, the autistics, mentally ill, and also the developmentally disabled. I've also been the director of case management for an agency in the New York City, and also the director of family and children's services for an organization on Long Island. For the last 8 years, I've had my own business, and I also have a private practice. Part-time, I'm also a professor at 2 universities where I teach online and also face-to-face. And I'm the immediate past division, vice president of the National Association of Social Workers, New York State, with a PhD in Human Services.
How long did it take you to get your PhD? How long did the process take? Like, how long have you been in school for this?
I would say between 3 to 4 years I have been.
3 to 4 years since you've gotten your bachelor's?
No, I got my
You had to get, what did you major in first off? What was your major originally, your bachelor's? What was your
My
bachelor's?
bachelor's degree is in social welfare, and my master's degree is in social work, and my PhD is in human services.
Okay, so you've always known you wanted to be a doctor, and or you just recently pursued on becoming a doctor?
It just happened.
It just happened. Okay.
Yes, I never thought of wanting to be a doctor, but it just
happened.
It just happened. As I'm originally from Trinidad, so I started in the field of social work in Trinidad actually, and when I came to the United States, I just continued with the profession. Okay. And over the years, I just continued, with upward mobility in the area of my academics, and that's how I got my PhD.
So even as a child, you knew you wanted to be in social welfare? Or some kind of social?
No, actually I changed when I graduated from high school. I was into accounting, and whilst I was in Trinidad, there was a very lucrative position that was advertised, and I applied, I got the position, and since then I've been in social work. Actually, during my work in Trinidad, I adopted a child. He was 3 years old at the time, and yeah, it's great. It was a great, phenomenal experience.
Oh, okay. Well, thank you for coming. We appreciate it.
Thank you for having me.
Shay?
What is attitudinal differences in mental health between young and older adults?
When we talk about attitudinal differences, we talk about feelings. What has happened is that young people, you're being educated. A lot of young people are being educated about mental health. With the older adults, a lot of them do have that stigma and that taboo about mental health. There's a stigma that, you know, in order for you to seek help, you have to be, you know, severe and persistent mentally ill, and that's not always true. What studies have shown, actually according to the World Health Organization, 1 in 8 children under the age of 18 do suffer from mental health within 1 year, and 1 in 4 adults suffer from mental illness within 1 year. What research has also shown is the fact that African Americans and also Hispanics, even though they suffer from mental health, they are less likely to seek treatment than their white counterparts. What studies have also shown is that less than 50% of those with a history of mental illness seek any type of help. And that is a major issue within the not just within the United States, but worldwide.
Why do you think that stigma is among the African American and Latino people?
The stigma is not just among the Latino and the African Americans.
To seek help, I should say.
I'm sorry?
To seek help, I should say. Why do you think they lack in trying to seek the help for their issues?
Okay. Many of them think they can deal with it on their own, and they continue to work on it. However, by the time they seek help is when they seek rock bottom, and most of them are hospitalized as a result of that. And it would take a longer period of time for the recovery process to continue. Again, like I indicated, the stigma that's attached to it. You know, just probably going into either a mental health clinic or into the office of a private practitioner to seek help. No one wants to be seen seeking that help. And I think that's something that, you know, everyone should take a look into, because if mental health should be treated the same as your physical health.
Yeah.
And if after today, I hope that anyone would take away from that is taking care of your mental health, because that's so important for your entire social functioning.
Okay, Larry?
What does it mean to have mental illness?
Mental illness, it's basically a diagnosis that we, as professionals, we use. We use a manual which we call the Diagnostic Statistical Manual. It's commonly known as the DSM-5. It actually was a DSM-4 and recently changed to the DSM-5. And basically what we do as professionals, we have a lot of questions that we ask, what we call an assessment. So someone comes into us for the first time, and we conduct an assessment, and based upon the questions and asked and the responses that are made, we are able to make a proper diagnosis for the individual.
What is considered a serious mental illness?
I would say almost every illness is serious, but it's just that some are just a little bit more serious than the others. A serious mental illness, it's one where you lose control of certain things. All right, you're not able to function adequately. You're not able to shower. You're not able to take care of what we call your ADL skills, that's your activity for the daily living skills. You're probably not able to attend work. You're having interpersonal problems. By that means conflict. You know, there's a lot of anger problems. Your cognitive functioning, you're not able to think clearly. You're not, you know, your sleeping is being affected. Sometimes when you talk about a serious illness, you can also, someone, let's say, who is suffering from schizophrenia, where they're hearing voices, they're paranoid. You know, all of these things are, you know, you take into consideration where you have serious illness. Then we have what we call severe and persistent mental illness. And that's the high end of the spectrum, such as someone suffering from schizophrenia. And that's one mental illness that's actually genetic. So if, let's say, your mother or your grandmother has a history of schizophrenia, there is a possibility that you can develop schizophrenia. the key thing with those with the severe and persistent mental illness is to be in treatment, to continue to be in treatment. Because what we do find is a lot of our patients who suffer from severe and persistent mental illness, many of them are not compliant with treatment services. And the other factor that you do find is even though they are compliant, they feel better, they stop services. And that actually creates, again, on the rebound, and they'll have to either be hospitalized or in some cases, the legal system has to become involved. As I was actually the supervisor of an ACT team, that's Assertive Community Treatment Program. And there we worked with some of the most severe and persistent mentally ill. Some of them are actually court-ordered to be in treatment. And because of the fact that they were non-compliant, we had the nurse, the psychiatrist, the case manager, and the social worker would visit them in their home and provide them with the necessary services on an almost daily basis.
How early can you detect schizophrenia in a patient?
Usually it's around age 14, but teenagers, yes. Most of the time it's around age 14.
Okay.
Teenagers.
What causes mental illness, and is it hereditary?
There's no real cause for no real known cause for mental illness. However, what studies have shown is that it can be either psychological, it can be biological, or it can be environmental. And I'll give you an example probably of environmental. When we talk about environmental, it could be a home environment. Let's say someone is growing up in a dysfunctional home. That can create a lot of stress and anxiety, okay? When we talk about environmental, we also look at changes that occurs in a person's lifestyle. Loss of a job, change of school, you all are young, okay? You look at from 12, 13, even 10, because you're developing much younger. You go through changes, physiological changes, and this can impact upon you also. And if you don't know how to cope with it, unfortunately, mental health disorders may occur. And one of the things we know with teenagers is a high incident rate of suicide among teenagers. And a lot of it is, the lack of coping skills with teenagers. When you think of the psychological, you can actually think of substance abuse. All right? One of the things with substance abuse is that it alters the brain. It alters the way you think, the way you function. Okay? So all of those are factors that can cause mental illness. And again, too, you have the genetic part of it also. And the two main disorders that are genetic, that it's schizophrenia, and you also have bipolar. Depression also genetic.
Can mental illness be prevented?
Can it be prevented? Yes, it can be prevented. And one of the things that, in order to prevent it, you want to look at the risk factors. So one of the things you want to do is to keep down risk factors, and you want to enhance the other factors to improve the social functioning. When I say risk factors, what I mean, let's say if someone is residing in a household where it's dysfunctional, or someone who has anger problems. All right, one of the things that you'll do if it's a dysfunctional home, part of it is trying to get out of that environment. So you will be in a more stabilized environment where there's less disruption. If the problem is with regards to finances, okay, one of the things you would want to do is to try to, the risk factor there would be the finances, so that may be causing the stress, which would lead to depression or anxiety, which may also lead to, unfortunately, those two disorders, especially depression and anxiety run hand in hand. That can actually lead to suicidal ideations, because with that lack of coping. So I can't cope, what should I do? But there are ways in which to deal with situations, and that's why therapy, we encourage everyone, once you begin feeling those early signs of depression or mental illness, is to seek help immediately. and not just seek it, because what we do find is a lot of people sometimes, they come in, they feel better after one session, and they think, hi, I'm cured. And no, you're not. It's a long-term situation where, you know, it has to be continuous in order for you to maintain, you know, healthy mental health.
Thank you for joining us. We'll be right back after this commercial break.
My name is Dr. Robert Brevard. I'm here for Multi-Medicine in Westbury, New York. We're located at 1065 Old Country Road, Suite 214. Been here for about 15 years. The practice has medical doctors, physical therapists, chiropractors, acupuncturists. We also do pain management, and we have orthopedists on staff. Here at Advanced Multi-Medicine Rehabilitation, we've got physical therapists on staff who treat an array of conditions, from neck pain to back pain, shoulder pain. We treat carpal tunnel. We treat a lot of car accident patients, slip and falls. We treat patients with knee injuries, with ankle injuries. We have state-of-the-art equipment. We've been here for over 15 years. Vast array of diagnostic testing, from x-rays to EMGs. What is an EMG? It's a diagnostic test that allows a doctor to determine where the pinched nerve is. Cora is a physical therapist at Advanced Multi-Medicine and Rehabilitation. She's working on Stephanie, who was involved recently in an automobile accident. Stephanie has tight thoracic and cervical musculature, and Cora is doing some myofascial release work and some therapeutic stretching, doing it to help her with her pain. Vicky is also a patient here at Advanced Multi-Medicine and Rehabilitation. Vicky is now working her leg muscles, specifically her quadricep muscles, trying to strengthen them after an injury she sustained. If you find yourself in need of any type of physical therapy, please don't hesitate to call Advanced Multi-Medicine and Rehabilitation, located in Westbury, New York, in Suite 214. Phone number is 516-334-7000, or find us on our website at advancedmultimedicine.com.
Welcome back, and thank you for joining us. We have Dr. Marson, and we're addressing mental health issues. We're going to go to Santia.
Yes. What are the common questions that teenagers ask you about depression, anxiety, and all that?
That's a great question, because many teenagers actually suffer from depression and anxiety, and some of them actually do inherit it from their parents or other family members. With depression, okay, what are some of the symptoms for depression? Does anyone know? Any one of you know what? I'm going to ask you the question. Any one of you know what maybe some of the symptoms for depression?
When someone looks at life just like all the negative of it and they don't really think positive.
Very pessimistic.
Absolutely. And she talked about anxiety. That actually is what increases the anxiety within a person, because it's all that negative thinking. So part of what you want to be able to do is to change that negative into a positive. There's a word that I hear quite frequently, not just with adolescents and teenagers, is I can't. Do you know what I say to everyone? There's no such word as I can't. Instead of saying I can't, you want to say, guess what? I can. Because whatever it is, you want to be positive. Because once you have that negative feeling, you'll just start spiraling out of control with all of those negative thoughts. So very good question. Anyone else with regards to a symptom for depression?
You isolate yourself?
You isolate yourself, absolutely. One of the things is that you don't have that joy in doing things that you would have done before. So let's say you were hanging out with your friends. You no longer want to hang out with your friends, but guess what? You remain at home, you're in the bedroom, you're just sleeping, or you're either you're sleeping or you're not sleeping. You're eating a lot or you're not eating at all. So it can go, you can have the positive to that, either eating too much or you're not eating. And one of the things a lot of people do when they have depression is what we call emotional eating. Anyone knows what that is?
Yes.
Yeah, like binging on food.
Okay, so you're stressed out, what do you do?
Eat.
And you eat all of the wrong foods. Okay?
Junk
So
foods.
part of, right, and that leads into another problem because we know of the high rates of obesity that we have in the United States. And not only that, the medical problems that are associated with obesity. Okay?
So
Any-
binge eating emotionally, that could be a sign of depression. Is that what you're saying, or I'm just
Overeating, yes. A lot.
Okay.
We have a lot of emotional eaters who are suffer from depression. Absolutely, absolutely.
Sorry, who has a question?
Anyone else with regards to some of the signs and symptoms?
You just want to stay in bed all day,
Yeah.
really. That's all
You
I
want to
can
stay
think
in
of.
bed and you just don't want to get out of bed. Absolutely. And part of what you want to do when that occurs, you want to be able to force yourself to get out of bed. Some people who are depressed would stay in bed for days without even taking a shower, okay, or even leaving home. And part of it is you want to, if it's happening to you or you see someone, it may be a friend, it may be a family member, you want to be able to encourage that person, because the key thing for someone who is suffering from mental illness is to have a very great support system. That's friends and family members. Could be a therapist, it could be a case manager, but others who are supportive to what they may be experiencing. Because you may be just seeing what that person, the outer aspect, you're seeing the behaviors, but you don't know what's going on within that person that may be causing the behaviors. And that's why one of the things that's very important as a mental health professional is a thorough evaluation must be conducted in order to really identify a proper diagnosis, and if the person is on medication, because some individuals may reach to the point where not just therapy, talk therapy would be adequate, they may also be on medication also. Whilst I'm on this point, I want to say that if someone is on medication, and the medication we use in mental health, we call it psychotropic medication. It is encouraged that once someone is on psychotropic medication, that they also seek therapy, psychotherapy, from a clinical or someone who is licensed. Okay, that's very important. So again, just to add to what you have asked with regards to what are some of the other the symptoms for depression, and you've named quite a few of them: the loss of interest, the eating or sleeping. You have suicidal ideations also, and that's very common. What you do have with a lot of teenagers, sometimes whether it's depression, it's stress, or it's anxiety, we see a lot of self-cutting, self-mutilation, where they want to actually feel that pain. So what do? They take the simplest thing. It could be a glass, it could be a hairpin, it could be a knife, it could be, and they're cutting. And that is really disastrous. So part of it is, again, there are professionals out there who can help. And it's always good to seek help, to talk to someone. And I encourage parents to encourage your children to talk to you, because a lot of children unfortunately say, guess what, I can't talk to my parents. Okay. For the anxiety, because a lot of adolescents also are treated for anxiety, because you're going through those different stages in your life. What are some of the different stages do you go through as you enter adolescence?
That awkward stage at first.
See?
And
It's an awkward stage, you said?
yeah, at first it is.
Why is it
Mm.
awkward?
Because, you know, you're hormonally changing and your body's changing in certain ways and you don't feel comfortable with the way you are, so that leads to some depression sometimes.
Absolutely. And guess what? No matter how great you are, no matter how beautiful, you always want to be someone else. You always want to look like someone else. What I always say, you are unique. You want to be who you are. Okay? And look at your beauty. It comes from the outside in and from the inside out. Be who you are. Always look at yourself every day in the mirror and say, you know what? I'm happy for who I am. I'm happy. I'm beautiful. Always look your best. And you know what I always say? Live each day that is like it's your last day. Now, I'm not telling you to go out there and do all the crazy things, that could be done. But you want to be able to be happy. You want to be able to enjoy life. Okay? And you want to be able to do things that are positive, because one of the things that we see a lot of teenagers do is what? They get involved into situations that are really risky. Very risky behaviors are exhibited. And one of the things that you want to be able to do is you're not 13 or 14 or 15 going on 35.
Yeah.
Do you know what I mean by that? What do I mean?
Not to really rush and hope that you're older.
Absolutely. 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 There's going to be that time where you're going to hit 35. And part of it, you want to look at what is appropriate for behavior at age 15, what's appropriate at age 16, what's appropriate at age 17. When working with adolescents, I always tell them, do a timeline. Do you know what a timeline is?
Yes.
What is a timeline?
Sorry?
A timeline is like since you were like born to how you are now.
Excellent. Because a lot of teenagers don't set goals for themselves. And it's important to set goals. So a timeline is really identifying, okay, here I am at age 15. Where would I like to be, or where do I see myself at age 20, age 25, age 30, age 35? Any one of you ever did a timeline?
Yes.
Okay. Any one of you would like to share where you would like to see yourself?
Like in 5 years, I'd hope to see myself living in the West and having a stable EKG job in a hospital or clinic and being married.
Good. Anyone else?
In like 5 years, I want to be graduated and in college.
So both of you, I'm hearing that higher education. You're very quiet next to me.
Oh,
Where do you see yourself in the next 5 years?
I graduated college and become like a photographer.
Okay, good.
Elizabeth?
I would like to have graduated and have my own business.
Great. And what I'm hearing from you, each one of you, is you are looking toward doing one of the key things to enhance your growth, and that's education. And that's very important. Many teenagers, unfortunately, don't think it's important, but it's very important. If you want to move up in life, if you want to get out of a specific socioeconomic status, whether you're in the lower class, you want to move up to the middle class, education, it's very, very important. And the one thing that I want to say as young people, sometimes you may think, oh my gosh, it's very expensive. Yes, education is very expensive in this country. However, for minorities, there are lots of scholarships that are available. So one of the things that you want to be able to do is to look at look for scholarships, start doing research, look for the areas in which you would like to pursue your academics, and start looking for even universities that may offer free, education for you. Because tuition, it's out there. You just have to, guess what? Look for it. It's not going to come to you and say, hey, you know what? I know you want this. Here it is. You have to look for it. And it's there. It's available. But many don't know about it. So you have to go out there. You have to pursue it. You have to be what we call that go-getter. Okay? It's very important.
Thank you.
We've been talking with Dr. Marson. We'll be right back after this commercial.
Hi, my name is Dr. Tom Dow. We have a multidisciplinary practice in Melville and Ronkonkoma, New York, and we treat patients with many, many different conditions, from newborns through geriatric patients with numerous different techniques. There's a technique and a type of treatment for every class of patient. We have them all here. Here's my son Thomas, also a doctor of chiropractic, working on one of our patients' cervical spine. This patient has had chronic neck pain for many, many, many years, has been to a multitude of different practitioners with little or no response. And with our specialized techniques, she has improved tremendously and continues to improve on a daily basis. We have two practices, one in Melville and one in Ronkonkoma, New York. We are a multidiscipline chiropractic office. What that means is we have chiropractors, massage therapists, acupuncturists, psychologists, all working as a team and a network of outside professionals such as orthopedists and neurologists that we work hand in hand with to help determine what your injuries are and the best way to treat your injuries. I have the great pleasure of having my son in practice with me. We work hand in hand, father and son, to give our patients the best care possible, and a staff which is loving, caring, and you'll never have to wait at all in our office for service. Many times patients come into our office and they have what's called a soft tissue injury. Soft tissue injuries are like scars inside your body. If you've ever been cut on the outside of your body, you get a scar. The same thing happens inside of your body to your muscles and ligaments. So our job is to determine where those are, stretch the muscles, adjust the vertebra back into their correct position, and then refortify the normal structure with exercise. That's what we do best, and I hope someday you'll come see us at one of our two offices. Thank you.
Welcome back. We're talking to Dr. Marson. We're addressing mental health issues, and we're going to finish our conversation with Shay.
What's the typical reaction people have when they see somebody with a mental illness?
Typical reaction, it all depends on the individual, and it all depends on the mental health problem that individual may have. But the one thing that I'd like to say, no matter what it is, you find that it can be very disturbing for you to see. So let's say it's someone with schizophrenia. Anyone ever experienced? Okay.
Well, what is schizophrenia?
Okay. That's a very debilitating mental illness that affects actually the brain in the individual. You have someone who probably may be paranoid schizophrenia, and that person would be just paranoid about everything. They'll be not sleeping, not eating, they'll be pacing back and forth. You can find that. They'll be speaking to you, and it certainly does not make any sense at all. They can be delusional, so they'll be seeing things or feeling things that's really not there. They can be hearing things, etc. So again, there's different types of schizophrenia. One of the things that you want to recognize is that once you see early signs or early symptoms of someone, because you can see the changes within a person, like one of the things you talked about with depression. So let's say it's a friend or a family member, okay, and you see that person is, was coming to school, her hair was always well kept, she was always neatly dressed, and all of a sudden, she's very disheveled, she doesn't care about her appearance, she's coming to school late, she's not coming at all. Those are warning signs that are there. Okay? So those are the things, and maybe rather than as teenagers, I always say teenagers can be very challenging towards their own peers. And guess what would one do? Rather than try to approach that friend and speak to that friend, many times they bully that person and make fun of that person. And that's why actually a lot of teenagers sometimes commit suicide. But instead of doing that, you want to be more positive. You want to be supportive, because it could have been anyone. It could be you in that situation. Okay?
Okay.
So part of it is when you see changes, just nice that, is everything okay? And usually you can tell. That's one key question. And maybe that first time the person may not have answer. You know, they may say, okay, everything is fine, everything is okay. But guess what? It may not be okay. But you keep asking the question until maybe that person would ask. I have some teenagers actually who would come in and they would actually refer their friends to therapy because they see that change. And maybe in talking, they may be experiencing, it could be problems at home. It may be problems at school. Okay? At this age, guess what? You are changing, you're developing, others are, are seeking an interest within you. You're not able to cope. There may be a difference in standards where your parents may not want you to date. You want to date. So there's a lot of conflict going on. Okay? So guess what? A teenager and their parent should be in therapy. Because I always say if it's the problem, in order to fix the problem, you have to fix the whole. So you have the teenager in therapy, and you also have the parent or parents in therapy. If it's with another sibling, you have that sibling in therapy, or the two siblings. Not wait until something that's tragic happens before you seek help. Okay? In therapy, it's not, like I've been saying, it's not just for those who are severe and persistent mentally ill. There is a disorder which we call adjustment disorder. I treat a lot of patients with adjustment disorder, a lot of teenagers also. And when we talk about adjustment, it's a change that what normally might have been going on in your life that may have occurred. So it may be transitioning, let's say, from high school to college, okay? It may be moving from your own home where you had your own bedroom to a one-bedroom apartment because of financial situations in your home. And that has created a lot of stress and anxiety within you, okay? And that changes, so you're not able to study, you're not able to function, and everything changes about you. Seek therapy. One of the things with regards to therapy is that it's very confidential. So whatever is discussed in therapy, it is not shared, not even with your parents, unless a teenager says that they are a danger to themselves or others. But everything else is kept confidential. Many times we have parents as professionals who would call us asking, so what did my daughter say to you? We cannot share it. It's confidential.
That's good.
Yes. And the other piece too, you just said it's good. What's really good about it, our professionals, we look at the situation objectively and not subjectively. Okay? And we do not judge you. So we are not judgmental. And that's the key piece. So part of it is being able to be free to talk. And don't feel embarrassed. You want to talk about exactly what's happening and don't hold back, because what you're holding back may be very important. I know that you probably may want to ask, okay, where do you seek treatment? All right, and what are some of the services that are probably available on Long Island? We have like the Mental Health Association of Nassau County. We have the Mental Health Association of Suffolk County. We have the National Alliance for the Mentally Ill, that's NAMI, and they are actually throughout the United States. We have some hospitals have support groups. One of the things I did not talk about was death and dying. Sometimes you do experience that, a lot of teenagers, and you're not able to cope with that. And you also have private therapists and non-for-profit organizations that offer therapy also.
I just want to ask one question. Sure. If, say, for instance, one of these young people want to seek therapy and without their parents, do they have to bring their parent with them to seek therapy?
Absolutely. Because they're under the age of 18, a parent must must accompany them during the first visit when the assessment is taking place. After that, the parents are not necessarily needed, but during that first visit. But it's always important to have those conjoined sessions sometimes, because most of the time the parent is a part of the issue for most teenagers. So if it is, then we try to, encourage the parent to come in. Many teenagers are very hesitant to do that. So as professionals, we, again, we give them time, we give them space, but we approach it to let them know that, it's very important that the parents do get involved.
Does anyone else have a question?
Are you finding more youth are becoming stressed over school?
Absolutely. How many of you have fun at school? Okay.
I'm not in school, so.
All right. It's a very difficult time for a lot of adolescents. Okay? One reason being, guess what? It's a time when you're going through all these different changes. And it's a time when your focus is a lot on what? Is it on your academics, or is it on your friends and, socializing?
Boyfriends, girlfriends. all
Boyfriend,
that.
exactly. So that's where that focus is. Okay? And a lot of adolescents have difficulty in the word we call balance. Have you ever heard that word? Okay, do you know what that means?
Yeah.
What does balance mean?
When you know how much time you can spend with your friends and then how much time you need for your actual schoolwork.
Absolutely. So guess what you do? You probably would spend at school, so you have time to spend at school, you have time to spend with your family. Unfortunately, for some teenagers, guess what? They are caregivers for the younger siblings. So they have also that responsibility also. There are some teenagers who are actually working. So then there's that responsibility also. Then you have your social life with your friends, and you have school, and you may be involved with other activities, other groups, etc. So you find that you have difficulty in balancing everything that you need to do. Okay? And that's key. And that's why a lot of teenagers become stressed and anxious. So it's very important to be able to balance. So and also with homework, not wait until the last moment.
No procrastination.
Yes, there are lots of procrastination.
Yes.
And a lot of procrastinating during adolescence. And that's one of the things that, as an adolescent, you want to try to work on, because the more you procrastinate, you put it back, and guess what? Do you think you'll be providing quality work at the end, or would you be providing substandard work at the end? You're rushing it, so you're not going to be able to do the research. And we even see it at a college level. All right, at university level, I see it all the time with students. And I can tell when students took their time to research and do a great job, and I can tell when they just, probably rushed it through and did a really poor job. And when you do a poor job, what happened? What kind of grade do you think you'll be getting?
Bad grades.
Exactly. Your grade would not be that great. All right? And as teenagers, you also, one of the things that you want to be able to do is also try to reach where? The sky. The sky is the limit. Okay? Always look for the best. Try to reach good higher and higher and higher. Because if you start off here, you don't have much to go. But if you start off here, and even though you drop here, you still have a lot. Okay? So always try to achieve the best. No matter what you're doing, you want to try to achieve the best. Okay? And set goals to yourself. All right? And that, guess what? Decreases some of the anxiety. And you want to give yourself time to do things. You just don't want to wait until the last minute. The other piece that you want to be able to do, and you want to start off at a very young age, is not doing too much at the same time. Okay? Because even as adults, we have difficulty in balancing.
Multitasking and everything. Yeah.
Absolutely, absolutely. Okay, so you want to try not to do too much at the same time. Okay.
Okay. Ms. Johnson?
Elizabeth, you have the next question.
What should someone do if someone who appears to have all the symptoms of a serious mental disorder?
Once someone has any symptoms of a serious or mental disorder, my suggestion would be to seek treatment immediately. And seeking treatment, if someone has a severe and persistent mental disorder or severe mental disorder, the first, if it's very severe, I would say go to the ER, because sometimes it's very difficult getting an appointment with a mental health professional. It's either seeing a psychiatrist, and this is a medical doctor who is trained in dealing with mental health, and also he or she can prescribe medication. We also have psychiatric nurse practitioners. They are nurses who are trained in mental health, and they can also prescribe medication. We also have psychologists who are trained to provide therapy. We have licensed clinical social workers who are also trained to provide therapy. We have mental health counselors, and we also have marriage and family therapy counselors. For those who are, let's say, Christians, there are also pastoral counselors who are trained to provide therapy for those who are, spiritual.
Okay, we want to thank, we're here speaking with Dr. Marson on mental health issues. We'll be right back after this commercial.
Welcome to Formula Auto Wash, where every day is a great day for a car wash. Open 7 days a week from 8 a.m. till 5:30 p.m. Sundays 8 a.m. till 4 p.m. Detailing packages for every budget, starting out at $29.99. 100% hand wash and detail centre. Hot hair and microfiber brushes and mitts. Proudly using Ecolab Blue Coral soaps and waxes. Formula Auto Wash has served the community for over 30 years. Senior discounts all day, every day. Ladies' Day Wednesday, $3 off any wash. Early bird discount Monday through Thursday till 9:30 a.m. Check out our website, formulaautowash.com.
YesWeCare.net is a 501c3 charity that provides help to veterans and their families. Please visit YesWeCare.net and donate in any way you can by purchasing our beautiful framed prints or relaxation CDs and DVDs, even smooth jazz CDs. YesWeCare.net. Remember, our troops are on their way home. They need all the support they can get. YesWeCare.net.
For professional motorcycle transport and towing, think Kickstart Fabrications Motorcycle Towing. Proudly serving all of Long Island, we feature expert handling and 24/7 service. So send a limo for your toy with Kickstart Fabrications Motorcycle Towing.
I'm Dr. Janine Burns, and you're watching Madhouse TV.
Welcome back. We are talking to Dr. Marson, and we're addressing mental illness.
Hi. Are the symptoms of depression and mental illness different from younger patients and older patients?
There's not much difference because with the signs of depression, we talked about, what are some of the symptoms. The problem with older adults, it's difficult to diagnose sometimes because it may be linked to medical problems, it may be linked to, old age, basically. The thing about depression is, I think that every older adult and every teenager should be assessed for depression, basically. Because of the fact that in order to receive the appropriate treatment, what we do find is that many older adults with the elderly they're on psychotropic medication, similar for anxiety also. A lot of them on anxiety medication that's prescribed by the general practitioner, that's your medical doctor, and not by a psychiatrist or a psychiatric nurse practitioner. We do find some general practitioners who would refer them for therapy, but it's always encouraged that once they are administering psychotropic medication, that they're also in therapy to help them to learn better ways to cope with cognitively with whatever is causing the depression. As we talk about depression actually in older adults, and we do see it happening in teenagers, some of them find actually unhealthy ways of coping. And when I say unhealthy ways, a lot of them are actually turning to alcohol. A lot of them are actually using prescription drugs. There's a trend among teenagers, even with drugs and alcohol, and that makes the symptomology even worse. So again, if someone is on psychotropic medication, they should not be using alcohol. Okay.
Thank you.
Whilst I am on this issue also, an issue among young children, and that's really dear to me because I've done extensive research in the area, is on sexual abuse. I think that everyone should be, especially every young person, should be actually, as a part of the intake process with mental health professionals, should be assessed for sexual abuse, physical abuse, and emotional abuse. Sexual abuse, it's, the effects can be long-term, and it can be very devastating.
Yes, there's a lot of trauma there.
There's a lot of trauma, absolutely, quite a lot of trauma. And it lasts a lifetime. It can interfere with your interpersonal relationships with others. It can interfere with, you can have significant health problems. It's associated with headaches. It's associated with increased anger, lack of impulse control. You find that some persons may be very social, some may be very cold. So there's a lot of, adverse effects, long-term effects for child abuse. So that's, if there's any teenager who is out there and who is listening, if you have been a victim of sexual abuse, I encourage you to really seek help for that treatment, because the sooner that you get help for it, the better it would be. Many adults wait until they are, many individuals wait until they're adults and they seek treatment, but by that time, they're already damaged, and their entire life, they are living a life that's certainly not worth living. When I say not worth living, I don't mean that you give up, but they can be living a happier life had they sought help early rather than later in life. Okay.
In adults, as they get older and the onset of Parkinson and Alzheimer's disease are diagnosed, is it possible to misdiagnose mental illness? If so, how are medical professionals able to differentiate in the illness?
Right. One of the things with Alzheimer's and Parkinson's, you see a degeneration, and sometimes it's very difficult because sometimes they, in addition to, especially with dementia, they have lost their cognitive ability sometimes, their memory. So it's very difficult. So sometimes you may have to, in order to conduct the evaluation with them, to assess them, it's always best to not just speak to the patient themselves, but to also speak to family members, so you can get a better assessment of what the nature of the problem is in assessing them. So sometimes, and even with children, it's although you asked that question, but one of the things I should have talked about, sometimes when you're conducting an assessment, if you find that you're not getting enough information from the individual and as a professional, what we do sometimes, we ask, can we speak to X, Y, and Z, and we get a release of information signed to speak to someone else in order to gather more information on the individual. So in this case, let's say the person is seeking mental health treatment, we may ask to speak to the person's primary care physician. We may ask to speak, if the person is seeing a neurologist, we may ask to speak to the neurologist to even get their records, etc. So you can get a better picture of, of what's happening with that person. If you're in school, we may ask to speak to your teacher, your guidance counselor, the school psychologist, etc. Okay.
How early can you detect Parkinson's and Alzheimer's in individuals? What's the earliest?
The earliest, I cannot give a specific age because that's not the area. I really do not focus with older adults. But one of the things that you want to recognize, even though it's something that you think that would be in old age, it's not necessarily older adults who are experiencing those two disabilities.
We would like for you to give your information to those that may be watching that would want to know how to contact you. If you give them your information.
Sure. My name again is Dr. Bernadette Marson. My telephone number is 1631-328-1709. Again, that's 1631-328-1709. My email address is info, that's info, at Marson, MARSON, consulting, CONSULTING.com. So info at marsonconsulting.com, or my website is www.marsonconsulting.com.
Also, if you've been watching All About Us Teen Talk TV, make sure you order your magazine All About Us at www.aauym.com. That is www.aauym.com. You can also, if you have any questions for Dr. Marson, if you forget her information, you can reach us at aau.tv.radio@gmail.com. That is aau.tv.radio@gmail.com. We have a few more minutes, so if we would just like to, wrap it up, and just, if there are any questions that you feel you want to ask Dr. Marson before we sign off, or anything that you would just like to glean some more knowledge from her, you can do so. I just have one question, though, we didn't address. And Larry, you need to ask that, the first question at the top.
Is mental illness sometimes misdiagnosed?
Absolutely. It's sometimes misdiagnosed. And in asking that question, one of the major disorders among young people, that's about African American males, many are misdiagnosed with ADHD. That's attention deficit hyperactivity disorder. That's one of the major mental health diagnoses we see in children. And as a result of that, many of these children are actually placed in special ed rather than a thorough assessment. What I always say is, again, you do conduct a proper assessment, because the child may be acting out. It may be issues that may be going on in the home environment. I talked about sexual abuse. That's actually one of the, a child can act out because of that. It could be something medical that could be going on with that particular child. There are so many issues that could be occurring. But again, too, the easiest thing is, in order to maintain that child within the classroom environment, you diagnose them with ADHD, and then they are placed on psychotropic medication. Many of them, again, too, are not in therapy. And that child should be also in therapy, in conjunction with the pharmacotherapy. So that's an important factor. And not just be in therapy, but consistent therapy. Because what we do find sometimes is that a lot of children sometimes have to depend on parents to take them for appointments, and parents might be too busy, so guess what? That child, does not is not able to go for the appointments. And there may be services that are out there that may be available. So again, I've given information with regards to the Mental Health Association of Nassau County, and also the Mental Health Association of Suffolk County. There's what we call children case management. I know there's a criteria that they have to meet in order to obtain those services. But again, there are services that are available.
We want to thank you for joining All About Us Teen Talk TV. We want to thank Dr. Marson for joining us and giving us a wealth of information on mental health. We look forward to seeing you next Thursday with Shoshana Gibbs for AAU Entrepreneurships on the Rise. Have a good night.